Thank you guys very much. I'm Mary Shelton. I'm the Director of Behavioral Health Operations at TennCare. And thank you to the Tennessee Commission on Children and Youth for the invitation to speak. On behalf of our Director, Gabe Roberts, we're honored to speak on children's services and our successes in improving health care. So now for something a little different. I'm not going to sing, but I'm going to share with you some slides. Our mission at the Division of TennCare is improving lives through high-quality, cost-effective care. And our vision is a healthier Tennessee. While this is the mission and vision of TennCare, we work daily with our contracted managed care organizations and their contracted providers, many of whom you've met around in the booths here. And all through our interactions with children, youth, and families, we serve every day to ensure a healthier Tennessee. So I'd also like to give you an introduction to TennCare. Here you see many of the components of the TennCare program. We serve approximately 1.3 million Tennesseans. We cover half of the children in the state of Tennessee and 20% of the state's population. We contract with 3 statewide health insurance plans: AmeriGroup, Blue Care, and United Healthcare. They are our partners to ensure better coordinated, more efficient, and higher quality care for our members. The managed care organizations also work to reduce avoidable emergency room visits and hospital stays. While our budget is approximately $12 billion, 74% of that goes directly to our 17,000 providers across the state who offer clinical services for our 1.3 million members. So just by a show of hands, how many providers do we have in the room here today? How many TennCare contracted providers? I know there were some around. They may have stepped out. All right, thank you guys very much. So TennCare enrollment for children and youth. Here are some enrollment numbers from January of this year. We served a total of 1.3 million members or Tennesseans or TennCare members in January. 746,760 of those TennCare members were between the ages of 0 and 18. Another 45,324 TennCare members are between the ages of 19 and 20. As you can see, this past month, over half of our TennCare members were comprised of children and youth. This drives many of our quality improvement programs on primary care and behavioral health. We work regularly with our managed care organizations and treatment and service providers to ensure we have high quality programs for our children, youth, and families. So listed here is a basic outline of our covered services for children and youth. Please note that this is not a complete list, but children and youth have full access to a continuum of physical and behavioral health services from inpatient to outpatient. Along with our managed care organizations, providers of these services are the backbone of the TennCare program. Again, we are thankful for those 17,000 treatment and service providers across the state and the high quality of services they deliver every day to our TennCare members. So I wanted to highlight 2 community-based mental health services. These services are provided to children and youth and families, most often in the home or community-based settings. This first one is near and dear to my heart. Along with a great team from TennCare and the managed care organizations and many providers in the state, we designed this program in 2016, and it launched December 1st, 2016, and it's been going strong for 2 years. This is Tennessee Health Link. It's a care coordination service where care managers work with families to ensure that the children and youth are properly referred to needed services. They have access, make sure they have access to comprehensive transitional care and follow-up. They provide patient and family support and also referral to community and social support services. So the care managers, they visit children and youth and families in the home. They accompany them to physician visits if necessary, or they may call the family to offer better care coordination. And they also reach out to the healthcare providers for care coordination. And then as you can see, Tennessee Health Link served 33,700 children and youth this past year. The next service is Comprehensive Child and Family Treatment, or CCFT as it's commonly known. CCFT provides intensive in-home therapy and care coordination. The therapists work with the children, youth, and families to provide stabilization and deter out-of-home placement. CCFT services are concentrated on child, family, and parental guardian behaviors and interaction, and the services are more treatment-oriented and situation-specific with a focus on short-term stabilization goals. It's one of the most important services that we offer through our managed care organizations. And then last year, 25,000 children and youth, along with their families, received comprehensive child and family treatment across the state. So why do we provide all these services? I want to share with you the impact that we're having. Our high-quality programs are having a positive impact on the health outcomes of our members. The next slides reflect data collected through our claims system. For our community mental health providers who offer Tennessee HealthLink, the service I just mentioned, we saw a higher percentage of achieving the quality measure benchmark for EPSDT, the early and periodic screening, diagnosis, and treatment. You know those as regularly scheduled examinations, also known as well-child visits for kids. These positive outcomes reflect the increased collaboration between our mental health providers and our primary care providers. These providers make phone calls and other contacts to follow up with the primary care and the mental health providers to ensure that they have a full picture of the child's mental health. The next three slides show improvements made by all providers serving children and youth who are contracted with our managed care organizations. These quality measures are national measures, and the Division of TennCare requires our managed care organizations to participate in these quality programs. Each managed care organization creates several performance improvement plans each year focused on increasing positive health outcomes. This slide shows the rate of children who are appropriately tested for the respiratory condition pharyngitis or sore throat. The appropriate testing rose by 14.5% from 2009 to 2017. This next slide shows the rate of follow-up care for children prescribed ADHD medication, and that rose by 13.74% from 2009 to 2017. And last, this slide shows the rate of adolescents who completed those well-child visits, and that rose by 12% from 2009 and 2000 to 2017. This is just a sample of the many quality measures that TennCare tracks each year. The measures keep us all accountable for ensuring high quality, cost-effective care. However, we're not done with improving our quality of services. The managed care organizations have trained their own staff and their contracted providers on the effects of adverse childhood experiences, or ACEs. As we all know, that adverse childhood experiences impact a person's lifelong health and well-being. The goal is to instill an understanding of the latest brain science and prevent and mitigate the impact of an adverse childhood experience. AmeriGroup, Blue Care, and United Healthcare are using the research and materials from Tennessee's Building Strong Brains initiative, and we are thankful to the Department of Children's Services leadership and for the Building Strong Brains program. TennCare and the managed care organizations are continuing to work to design even more trainings focused on adverse childhood experiences for our contracted providers and then for all the members that we serve. These include parenting skills trainings for in-home therapists and care coordinators, identifying providers who are trained in trauma-informed care, and training our primary care physicians and pediatricians on adverse childhood experiences. So we are pleased to share with you this overview of our services, the positive health outcomes, and our future plans for ensuring all of our members continue to receive high-quality, cost-effective care. It was my pleasure to be here today to speak with you, and thank you very much.